so we've got a patient here. Alright, he's here for a heart transplant. We actually just did a heart transplant, like right now. So, you know, I think I can do this. You know, I'm a seasoned professional. Alright? Alright, now let's see. Patient name Bob. Alright. Ooh. Man, whoever did that last one sucks. Alright, well, we'll just try to do better than that guy, alright? Yeah. Alright, so this is going to be like a tutorial on how to perform a heart transplant. Alright, so, first of all, you want to start by getting rid of this piece of cloth or tarp or whatever the hell this is. You just want to grab it, and you want to just get it out of here, because we don't need it. All right. Now, there's multiple ways in which you can go about getting rid of the ribs. Personally, I always like to start by giving good old Bob a little piece of my mind, if you know what I'm saying. So, go ahead and just do one of these. You know, let him know that you're here for him, but let him know that you're not taking his shit. Alright, so you want to get rid of this mug because it's in the way. Alright, now you want to very carefully pick up this saw here. Alright. And you want to just start. Just go ham on these ribs, you know what I mean? Yeah, there you go. Alright, don't worry, don't you worry, Bob. Everything's fine. You're gonna be okay. Man, that's a really shitty way of grabbing that. Anyway. Just continue like so. There you go. Everything's fine. Oh, well, yes, that can sometimes happen, but if that does happen to happen, don't panic. You just want to keep going with the procedure as normal. Don't pay any mind to it. Alright, we'll address the bleeding later. Now, there we go. Nice clean cut. Alright, we don't need this thing anymore. Get it out of here. I should probably take this syringe here and just give him a little poke. You know, just give him a little. There you go. Just give him a little poke. That's all you need. So, you're probably thinking, well, now that the ribs are broken, what do I do? And I humbly retort, shut your ass. Alright? You want to just pick up the rib cage and get that shit out of here. He doesn't need it. Alright? Get it out of there. Alright, well, that's probably about as good as it's gonna get. And now, what you want to do is, you want to get the lungs out. Alright? And you're probably thinking, like, well, shouldn't you get all those extra bone fragments out of his chest cavity? To which I once again humbly retort, shut your ass. Alright? You just want to grab a lung. Alright. You grab a lung. There you go. And just, you know what I'm saying? You're probably thinking, like, what do I want to do with it? Get the shit out of here. That's what you want to do with it. Alright. Now, you know what? Let's get that one out. Let's get that one out. We probably shouldn't leave that in there, right? Alright, now you want to take this other lung. I said you want to take this other lung. I said take the other lung. There you go. And just, you know, get it out of here. He doesn't need it. Alright? He's already not breathing anyway. He's fine. Alright, now you want to take the liver, and you just want to give it the old, same treatment as the lungs, and just get it out of here. He doesn't need it. Alright, he'll be perfectly fine without it. Alright. Take this cup, and just toss it to the side. Oh. I don't think that's good. Alright, now you want to take this scalpel, and you want to make a cut right there. Alright, and then you want to do the same thing just right down here. And this is the, yeah, I couldn't tell you what that is. It's probably like penis or something. Okay, so now that we've made those two cuts, we can go ahead and get this little snake out of it, you know? Get that out of here. You don't need it. Alright, now you want to take the organ itself, and you just want to grab it. I said you want to grab it. You want to grab it. You want to grab it. You want to... There we go. Wait. No! No! You want to... No! You want to grab it. There we go. And you want to toss it. Because, again, you don't need it. Now, he is bleeding a little bit, and we can stop the... Oh, no. No. Alright, we can go ahead and stop that real quick. So, I'm probably just going to go ahead and do that, because that's, probably the best course of action right now. Just to try and stop that. But, alright, for right now, we're just going to put this back down. Now, I should emphasize, you want to be very careful cutting this thing, because any minor slip-up will cause insane amounts of bleeding, so you don't want that. Alright, now go ahead and just, just gently ease in. Make a couple of cuts. Alright, there you go. There's the heart. You want to take your hand and just grab the heart. And just grab the heart. There you go. Yeah, ew, look at that. Ew, look, ew, get it out of here. Alright. Now, you take this, pick this up. This is where the second heart's gonna be. You just want to pick this up. You want to open this container here. I said you want to open this container here. Well, that's certainly one way to do it. You want to take this heart and just toss it in. Yeah. See? Done and dusted. And ultimately, I think our good buddy Bob here is going to be just fine. See, we even got a B for Bob. He's okay. He's going to be okay. Right? Right? Right?